Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Hello and welcome to GRACE Breast Cancer video series. My name is Medhavi Gupta. Today we'll be chatting about surgical management of breast cancer. I'm joined by Dr. Jessica Young. Dr. Young is an assistant professor with the Division of Surgical Oncology at Roswell Park Comprehensive Cancer Center in Buffalo, New York. She is also a member of National Comprehensive Cancer Network, or NCCN Guidelines Panel for Breast Cancer. Welcome, Dr. Young. It's a pleasure to have you with us. So why don't we start the discussion by talking about the role of surgery in the management of patients with breast cancer?
So breast cancer is obviously a really popular field, and surgery for breast cancer is really one of the mainstays of treatment. There's so many different kinds of treatment for breast cancer now, but surgery is really still the main focus in terms of making sure the primary tumor comes out.
Could you also talk about the different types of surgeries?
Absolutely. So when we think about breast cancer surgery, I tend to like to split everything into two different groups. One part is really just what are we going to do about the primary tumor in the breast? And then the second part is really whether we have to do anything in the lymph nodes, and if so, what do we need to do? A lot of patients tend to focus on the breast area, which is very understandable. That's the part that they see more and they understand more. But they're really actually two sort of separate areas. So in terms of the breast, generally speaking, we can really usually offer two options. One is to have a lumpectomy, which is a small area of the breast where the cancer is removed, but really leaving the rest of the breast intact. So the nipple stays the same, the breast shape stays the same. It is a smaller surgery and relatively easier recovery. And then we have the mastectomy, which is where we remove the entire breast and all of the breast tissue on that side, including the cancer, obviously. But that is a very different surgery in that it is much more deforming. It's a larger surgery, and so there's a lot more recovery with that. Sometimes we're not able to offer the lumpectomy for some patients when, for example, the mass is too large and their breast size is relatively too small. If we think that it's not going to look good, then it's not something that we'll offer them. In terms of mastectomies, there are actually several different types of mastectomies that you can have. You can have what's called a simple mastectomy, where we take the nipple and the areola and all the breast tissue and quite a bit of skin. And usually that patient does not have reconstruction. And so that's just flat on the chest wall. You can also have reconstruction with mastectomies, and sometimes we take the nipple and sometimes we do what's called a nipple sparing mastectomy, and then there are different kinds of reconstruction with that as well. So depending on what you're a candidate for or what you want to have, or whether you're a candidate at all, you can have an implant-based reconstruction or sometimes a tissue-based reconstruction, or we also call that autologous.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelexis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.